can tell you that within recent years, though, and Dr. Isley, you said you've been here 4 years, we are hearing eyes and ears, and I'm sure you too, Dr. Perlmutter, wonderful things about the hospital. I mean, there was a time when people were not as positive about it as they are now, but I think we have come to a whole new level of excellence. In some of our, like cardiology and cancer, are actual branches of UNC Chapel Hill in our facility. I mean, how great is that we have a comprehensive cancer center and a just stellar heart center, and we'll get into some of the awards later on. But I'd love for us to pull up the profile, since he's kind of describing it, and let people see like the 4 facilities and kind of the description. There you go. You want to kind of talk to us a little bit about that,
Sure.
Dr. Isley?
And many in the community know this. I speak to many individuals that were either born in the hospital as it opened, or their parents or grandparents were transferred over from one of the other hospitals the day that it opened, and I get to hear all kinds of interesting stories, and certainly I'm a student of history and enjoy hearing all about our background and our history. So we were founded in 1971, so we've been celebrated our 50th anniversary last May, so we're coming up on 51 years. I'm the 4th CEO. I think that's really a unique characteristic and positive quality of this health system, is that in 50-some years there's only been 4 CEOs, and I'm the 4th. And so many of the individuals that I work with still tell me stories about Brian T. Aldridge, our first CEO, who actually oversaw the construction of the hospital. And so to be in an organization that actually individuals who still are working, who worked with the first CEO, is a very unique experience. And so we have 4 facilities. We have 3 licensed hospitals, but we talk about it in 4 facilities. Nash General Hospital, which is our acute and intensive care hospital. That's where most of our patients interact with us at and go for care. That's where the emergency department is, our surgery suites, imaging, lab, the things that we think of traditionally as a hospital. Attached to that is Nash Day Hospital. At one point in our history, it was actually a licensed hospital, but it's in the mid-late 80s, we actually moved it over into Nash General. So, but it is where we do all our outpatient. Prior to COVID, we did outpatient surgery there, but because of COVID, we had to consolidate into Nash General. We do have plans for opening and expanding back into Nash Day for surgery on a limited basis. We do our rehab, radiology, endoscopy. To our discussions earlier this evening, the cancer center is attached to Nash Day Hospital, kind of on the far end of the hospital. We have our behavioral health hospital located on the campus. It's across from the emergency department, across the kind of the field, and it takes care of behavioral health, psychiatric needs for our community, and does a really good job. We have continued to work and improve upon our relationship with our behavioral health providers in the community to ensure that our community has the services that they need. And then Brian T. Aldridge Rehab Center, named for our first CEO. Many of us call it BTAR. There, it is a 23 inpatient rehab hospital. It is across the street from our parking deck and near one of our, we call lakes there on campus. Yes. And so it is really a renowned, not only for our community, but across the region for the service that we provide there at the rehab hospital, and has been recognized by many third-party evaluation organizations for the work that we do.
And it's just a stunningly beautiful facility.
It is excellent. It is
right.
By and far. The pool, the dining facility, just everything was done top notch, and so continues to be in great shape there. The viewers can see that we continue to be a busy hospital. Our emergency department sees close to 70,000 patients. We're one of the busiest emergency departments in the UNC system. And so for a community our size, the emergency department sees a lot of business. And then we continue to offer many of the services that you would expect to receive in a larger area and town, but because of our proximity and the vision of the board, the medical staff's collaboration, we've been able to bring those services here locally in the community.
And with excellence, too. I mean, we're doing 1,200 cardiac catheterizations a year, delivering 1,000 babies, and are approaching 9,000 surgeries a year.
Yeah. So that for the viewer, it's certainly hard to know if you're not in the business whether those numbers mean anything, but 1,200 catheterizations means that you're doing a lot of catheterizations for a community our size. It certainly means that the physicians that are doing those catheterizations have plenty of experience and are well.
And many of the patients are in fact coming from out of our typical service demographic because of the excellence. And that's true for our cancer center as well.
So certainly some of our services, we'll talk a little bit more. I'd love to talk about our orthopedics, our general surgery, cancer, and cardiology. And to your point, certainly in those four service areas, we're drawing outside of Nash County and drawing individuals who want to come for those services.
For the excellence of those services.
That's right.
Because they can, many of these communities, they can get those services quite locally.